Welcome to the Totally Adequate podcast, produced by Quest Analytics. Here, we dive into the latest news, policies, and innovations in healthcare provider network management with industry leaders who are shaping the future of care. Our mission? To elevate community health across the nation through superior provider networks.
Hello, I'm April Beane, and welcome back to the Totally Adequate podcast. I'm so excited to have you all join us here today. This may be one of my favorite episodes I've ever been able to host. I'm super excited to have the fantastic women that are on here today. I'm not going to go into their full bios because that would take the entire episode, but I do want to hit the high ones. Shanna Adamic, thank you so much for joining us here today. Author of Audacious, Optimism, Oracle executive, former NFL cheerleader, brain tumor survivor. We're going to talk more about that. And healthcare transformation advocate. I could go on, but we're super excited to have you. And joining you here today is Barbara Dumery, Chief Product Officer here at Quest Analytics, Health Tech Innovator, and one of the top 10 Women in Healthcare Award winner in 2021. So thank you both, ladies, for joining us here today.
Thank you, April.
Now, our audience may be wondering why. I mean, I'm sure they're excited to see both of you on the podcast, but why are we bringing both of you together on this episode today? And we're really kind of talking around the theme of improving the patient experience through optimism, using your word, Shanna, and innovation, Barbara, which I know is where your passion lies. So really, when we talk about transformation within, the health systems and patient advocacy, the patient journey, access to care. I know, Shanna, you get to talk in your role at Oracle and as the executive communications person there. You're usually on the other side of the mic talking to subject matter experts, innovators in the field who are doing AI, machine learning, things like that, really trying to make access to care and the patient experience better, faster. And where that intersection on this call here happens today is Barbara is one of the individuals making those innovations happen in the industry today, right here at Quest Analytics. So really bringing you two together to talk about how do we get there faster. And Shanna, I'm going to quote you from our discovery call because I thought something you said was really pertinent to the conversation we're about to have. And I'm going to quote you when we were talking about why we should innovate in this space, why we should make things faster. You had said, because every single person will be a patient and experience the healthcare system we are building today. And I think that resonates and is so true that, you had your healthcare journey. We're all going to have our healthcare journeys, or we're going to have to help a loved one through a healthcare journey. So it's really, the mission at Quest Analytics too is to improve access to care. And we're doing that through innovation. The industry is doing that through innovation. Shanna, you've talked to a lot of folks who are an integral part of that. And so we want to talk about how we can get there faster. How do we innovate to create that space in order to improve that healthcare journey, not only for everyone, but for ourselves, right? This is a personal mission a little bit in there too. So Shanna, I want to let you kick it off. You had quite the healthcare journey. I know you've told this story a lot, but I think it's important foundationally to kind of tell us how you got to here, because I know it's that experience that has, ignited your passion for storytelling to ignite hope and spark change in the industry.
Yeah, well, thank you so much. And what a beautiful intro. And Barbara, I'm so happy to be here with you today and having this conversation. And I know the three of us could probably talk forever. And I know we only have a very short amount of time, but thank you so much for sharing that quote. When you said you're going to share a quote, I'm like, oh gosh, which one is it? And so I love that. And I lead a lot of discussions with that at the very front end, because I think that, we're all looking for points and threads to pull that could unify us. And if there's one thing that can unify us all, it's that aspect of a patient, that we will either be a patient ourselves, we will care for a patient, but somehow we are going to experience, if we haven't already, that the healthcare industry and healthcare, as you mentioned, is very personal. And so that's how we have to approach this, as it's personal to us, it's personal to the people in our lives who we love in the future. And one thing that I am, I'm really passionate about in that is that this future that we are creating has the possibility to that, we get to reverse something that has been different for us and how we've experienced healthcare. And it's that we always experience the crisis before the care. What if we experience the care before the crisis? And that's the goal of what we want to try and build. For me and in my journey, I started years ago. I won't tell you how many years because then we'll all do the math, And so, but years ago, and working with a company who was digitizing healthcare, and this is decades ago, and working in a space where I wasn't working directly with the digitization, but I was working in a philanthropic side of it, which was really creating this bridge of to philanthropy and how we help those same people get access to care that we were trying to transform the future for. I tell you that because it's important, because I've lived this journey of digitizing healthcare, as we all have, but in a way that I was on the side of seeing it being created and implemented and then experiencing it. And a quick version of my health journey that I never thought I would experience. And who does think that they're going to experience a health journey that is so personal and also kind of shatters a moment where you realize there is a before and after in your life. You remember the moment before it happens, and then it changes your life after. And that's what happened to me. While I was working for this company, digitizing healthcare, I was also living out a dream of mine, which was with my professional sport, which was dancing and cheering in the NFL. I cheered for the Kansas City Chiefs for nearly a decade, became one of their longest tenured cheerleaders, actually got the nickname of a fossil, which was a very endearing nickname, I might add. Okay. But towards the end of my tenure, I started to lose my hearing on the right side. And it was blamed at first on that I had cheered in a Lattice Stadium in the NFL, and that sounded right until it didn't. And then I kept going back and to the doctor, my primary care physician, specialist ER visits. 6 years, I went back. 109 engagements with a primary care physician, an ER or specialist, and with growing symptoms. And I say that number not to criticize the healthcare industry, because I think everyone had been doing their best. But again, I go back to the digitizing, is that we were all trying to get to where we're going to go now because we had to digitize first. And it also created some noise with creating big medical journals that weren't necessarily connected. And that's what I experienced because there was disconnect in my story along the way. When I finally was able to get back into a specialist in that last time, to push one more time, to kind of share my story like a story and say all of these pain points, what were the growing symptoms? Hearing loss, vision problems, speech problems, dizziness, vertigo. What had it been blamed on? Common cold, sinus infections, headaches, dehydration, Meniere's disease, benign positional vertigo. Z-Pak was thrown at everything that it could be. Again, just covering all bases, because from the outside, it looked like I was a high functioning person, and it could have been caused by many, many things. When I pushed that last time and went into that specialist and told that story a bit differently, I got a little bit of a different outcome and some feedback of, hey, let's really dig into this and see what's happening. And I was sent for a second head scan by that time in my journey, MRI. And 20 minutes after my MRI, a very different diagnosis was given to me. And I was given the diagnosis of a 4.5 centimeter brain tumor that was compressing my brain stem. And it was big. It was life-threatening. It was benign, but it was life-threatening because of the location and that it was compressing the brainstem. The hard part about this was, Barbara and April, is that it is a tumor that's considered manageable. And mine was no longer considered manageable because it had been allowed to grow for so many years. And so I went into a fight for my life mode and knew I needed to get a second opinion because the care that I needed wasn't, their expertise, even though so thankful for getting that diagnosis there. Took to, after trying to get a second opinion, which was almost virtually impossible by myself, took to social media and got a reach out from someone on social media who I had gone to college with years and years before, who was a facial nerve reconstruction surgeon, and worked for the doctors who were considered the experts in my tumor, and was able to get up to the care that I needed. Changed my entire story. On certain stages, I will say what a luxury that is, that I had those resources and to get there when I needed. And it changed my journey and to that point of personalized care. And so that was 2018, April. And Barbara, I underwent a 13-hour translabyrinth craniotomy that removed the entire tumor. And I woke up to a very different reality of permanent hearing loss on my right side, loss of motor skills, facial paralysis, and the journey went on from there. So that is the stake in the ground of when I felt healthcare was personal in a very different way. And I realized what my role could be in that, and sharing the story, helping to connect the dots, and really what an incredible opportunity that I was part of this company that's leading this transformation in so many different levels of the ecosystem, that I can really be there to be part of this future where care will come before the crisis.
Wow, this, I've listened to your story on other podcasts. I've read your book, but it is so powerful to hear you say it. Even in the shortened version, because I know you can talk about that experience for a very long time and how impactful it was for you. But it is powerful to listen to, and it also, you can feel the struggle in it. You can feel how frustrating that can be. And I know many people on this who are listening have been through that struggle, either personally, like you said, again, a personal journey, or with loved ones where, you have to be your own advocate and you have to navigate the system. And, it's great to see people like you, Shanna and Barbara, working to try and make that easier. Right. So, Shanna, when you said that's a stake in the ground and really inspired you to try and make a difference through the conversations you're having, the work that you do, what's the most urgent gaps that you're seeing in the patient journey today, or the gaps in the healthcare system? Like, you experienced it firsthand. You've talked to these folks. What comes top to mind of what's urgent?
I think the most urgent, and this is my personal opinion, is something that I think is urgent both for the clinicians, those who providing care, and the patients, and that's access to data, and data that is actually actionable. Like, what can I do with that? Like, I think about my own story, and I think, how might my story have been different, or how can it be different for others in the future if, those symptoms are immediately compared to everyone around the world who has ever experienced those symptoms. And, you have that immediate data at your fingertips of comparison, but then, and also care. And that is given to both the physician without the burden of digging to try and find it. And it's given to the patient as a very transparent form of them being part of what their care is going to be and the options they have. So that would be what I personally feel is the most urgent, is that piece of that data to truly be something that changes the story and changes the way that our expert clinicians around the world can care for us.
Yeah, the American Hospital Association, I pulled this out, shows that nearly 1 in 4 insured patients delay or avoid care due to administrative burdens like scheduling. And so
Yes.
it is true, right? Like, this is a truth in our industry. And Barbara, I think this leads right in to you when we're talking about data. I know we've talked about, the three of us in other conversations, how, electronic medical records, EMR, this digitization that I can't say at the moment, is something that was revolutionary at the time. But also, now that you look back on it, it created some noise, right? When you look at it from a data perspective. So, Barbara, how is technology, how are the things that you're doing, the things that people like you are doing in the industry, looking to improve the data, improve the provider network intelligence, right, to improve access?
Yeah, absolutely. And Sean, I just want to say to how touching your story is. I'm sorry that you had that experience, but I'm so impressed with what you've taken away from that and the impact that you're having on the industry now. So thank you for all of the sort of innovation and leadership that you're bringing. And you're absolutely right that it's this big shift that happened, especially with the meaningful use changes that happened really, 10, 15, 20 years ago with the, revolution of the electronic medical record. But what's so interesting is it all really starts with making sure that you're able to get access to the right providers to start with. When I think, Shanna, about the start of your journey, right, that winding the clock back 6 years prior, if you had been able to see the right specialist at the right time and it was convenient for you and accessible to you, and really sort of zooming out and saying, how do we make sure as an industry that we have all of these clinicians that are really able to provide care and making sure that it's care before the real crisis hits. It all starts with the patient or the member being able to see their provider. And then once they see their provider, making sure that that information is shared, that it's connected, that you're able to really get the insights that you need across the board. Who are the providers that are going that extra mile to really make sure that the outcomes are better? So it's all about, who's in your network that you can go and access, and are they providing the best quality care for the members and for the patients? And like you said, ultimately, it's all a very personal story, right? Either for ourselves or for our loved ones. We will all be patients, unfortunately. And so this is something that is so important for us to address as an industry overall.
Yeah, no, I think it just is. I think there is just, especially when the crisis hits, there is this moment of like, who do I even go see?
Right.
Like, is this the right person? Like, and it's, I mean, it takes the breath out of you when you're trying to figure that out. And it's, I think that's such a huge piece, is really understanding, who's going to be, my Cadillac care provider. Like, how do I know who that is? And so I think that's such a, that's such an important piece of that pie. And then, going back to that thought of where we started with the EHR and where it's going now, this conversation is in the future of healthcare conversation. It kind of always had stemmed on, it kind of always just came from the EHR and how groundbreaking that was, which it was. And now it's so much more, because the entire ecosystem has to be connected for all of those pieces to fit together, to know where you're going to go, to know where the information is. All the information will be there, all of those pieces. I feel like it's one of those places, Barbara, in April, where I feel just truly energized by right now, because it really is like these things are within our reach, things that we thought were impossible. And it's even hard to put into words, but if you can think it, I think it can be done.
Yeah. I think what's so interesting too in that is, if we think about the needs and how they vary across the type of patients that can exist, or types of members, you have folks that are earlier, they're younger, maybe they've just gotten their first job. For them, it's really about preventative care, right? And if they're able to see a primary care doctor on a regular basis, that's a huge predictor of really positive, and sort of wellness outcomes that I think are so important. And then certainly there's folks that are in their later stages of their life where they're dealing with multiple chronic conditions. And how are they able to see the specialists when they're, juggling all of these different demands that they have, and also burdened with their health struggles themselves, right? How do they navigate all of that? I think it's so interesting to think about, how do we make sure we're up-leveling that healthcare for everyone, and really making sure that everybody's able to get access to the care that they need across these different stages, and how important that is to then have a good predictor of outcomes.
Yeah, absolutely. Absolutely. And that's where I feel like, even like across that line, which you mentioned, like the young and the healthy, trying to stay healthy. And then, And as we age, like who's there for me now, and in every single stage, whether that's, no matter if that's crisis or not, it's just every single stage. And I think that's, where the very timely conversation in the moment that we're in, where we find ourselves in the AI era, where there is this ability for AI to become healthcare's superpower.
Mm-hmm.
And that's what this hope is for this moment of being able to put that in place to where it's technology then becomes not something that we're trying to dig into and work on to get to work. It becomes something that begins to work for us.
Yeah.
At every stage.
Yeah. And as a technologist, I am so excited about where AI is going. And I don't know, April, if I'm going too far.
I'm like a fly on the wall, just mesmerized by the conversation. This is amazing. Like you said, I think you ladies could get in a room and have a conversation and solve a lot of problems. Days upon days. But no, you're doing great, Barbara. I was going to go right in that direction. I know AI is right at the heart of a lot of conversations you're having. But when you're talking about data, and we talked about the noise in the system right now with data, AI is here. It's now. Shanna, you're having those conversations all the time. But there's a little bit of catch up the data needs to have in order for the AI to be effective. And I know, Barbara, I know you've been, thinking a lot about that recently.
Yeah, there are a number of ways that Quest Analytics leverages AI, not only for our processes internally, it's how we're coding, how we're testing, how we're doing design. There's so many more tools that are available to us now to make us really more productive and be able to deliver client value faster. But really, it's always going back to that patient and that member experience. What we have seen is when we think about, providers, doctors out there in the landscape, we see that 30 to 40% of the doctors and where they work changes on an annual basis, which is huge. It's so hard to then get your finger on the pulse of, wait, where do I need to go and where do I need to drive to be able to, make an appointment, be able to be seen, be able to be heard with the conditions that I have. It's so much more dynamic. And of course, there's ways of doing outreach, of, really checking in with all of those providers, but that's hard for that to scale. And so one of the ways that we have been leveraging AI is to really have this very strong model that says we can predict that that provider will be at that location. And so that when a member is pulling up their provider directory as part of their insurance network, they can have confidence that when they make that phone call, we know that they're already at a point where, hey, I need help. I need care. What they don't want is it to be, a Pizza Hut that they're calling instead, right?
Right.
You really want to make sure. And that's a huge impact on the member experiences. The network that they see is the network that they can actually experience and get access to. So we have a number of different AI capabilities that able to, really have that confidence of, yes, that provider is at that location.
That is really, really important. I mean, I don't want to call and find a Pizza Hut when
Exactly.
It cleans everything up. It makes it real so that it's like, and that's, a huge point of trust, which is absolutely crucial for anyone who is, health, wellness, no matter what that is, like that to know that trust is there. And I think that, when we talk about, AI, it's so, you said something at the very beginning I just loved too, because I feel like I've just had this conversation about something. It's that it's so important for everyone to have, I think, an individual AI playbook, a company AI playbook. And it's like things that you're using yourself and internally, if you're also going to be using it in industries. And so like, I think it's, we're all sort of, we're all on this journey together. And I just had this fascinating conversation with a leader in Google and talking about that we're in this moment of an AI window where it's like, there is a lot of information that we need to learn fast because AI is moving so quickly. that it's going to advance before we can catch up to it. If, and I think that's, going back to that, practicing, and implementing those AI practices and processes inside organizations, but also individually is so important. Okay, that was a little side tangent, but I'm really passionate about that too. But then to be able to use that in the industries that are being supported, and the one we're speaking about is within healthcare. And I think one of the important things, getting back to the data piece, is that one thing that I'm learning, and I am not an AI expert. I am in the conversation and get to be with a company who is really just changing the landscape of it, of many industries. But one thing that I'm definitely seeing and taking note on is that there is going to be a very defining difference between companies who are just layering AI on to old technology and companies who are embedding AI in or rebuilding their technology with AI at the core to help with that data polling and making sure it's right and that it's real information. And I think that it's that's where AI is really going to change that healthcare landscape, is being able to pull from the very beginning all of that information together. We know it's real. Anyone who's looking at it know it's real, whether it's the patient or the clinician, whoever it might be. But it's there and it's ready to go. And so Pizza Huts aren't involved in healthcare.
That's right. And I love what you're saying too, of this window that we have and this opportunity that we have. And there will be different approaches that companies take. There will be many that just layer on to, their legacy systems, or layer on to, really it's a commoditized AI capability.
Right.
And in some ways that's going to be really much easier to do. You can just have a UI all of a sudden, or have a solution all of a sudden. But you got to layer that, peel those layers back and see what is underlying that, what's underpinning it, and what's the true sort of differentiation. And what we see is that it comes back to the data. Do we have the best signals to be able to predict what the network will behave like, and what that true marketability and experience will be for the members? And we sit in a really unique place, and it's one that we don't take lightly. It's one that we've earned with our regulator relationships and with our, payer relationships. We're one of the few companies that has this kind of relationship with so many different payers and the regulators. So we have that underlying data, and we have the attestations also from the providers. That's a really unique place to sit. And so we see that there's sort of endless possibilities to, even deliver more insights about the network and what that experience will be, because we have that data.
There's so much innovation that's happening, and both of you are at the forefront of it. You're both talking to folks like Google, like all over the industry that are embracing AI in different ways, looking at how, we keep saying across the industry, we're information, data rich, but information poor, meaning we have all this data and we're learning how to gather it together to actually make it informative, right? So that we can improve that access to care and that patient experience. And to your point, Shanna, this isn't something 5 years down the road. This is something that we're living and breathing and doing right now. And it's really exciting to be a part of it and hear both your perspectives as you're going through this journey, and how it relates personally to you. I know you mentioned regulations briefly, Barbara. So, let's add one more piece of complexity into this, right? So we're talking about the patient experience and we're talking about the data, but then we also have these regulations that we have to fit within that are complex and ever evolving, right? And are focused on making sure there's access to care. But, as we improve our systems, as we look to our systems, how do we look at improving healthcare? What does that look like when you're trying to balance regulations, balance the data, and in the end, right, always building everything to have that patient experience, that access to care as the end result, right? Like that's the thing you're trying to improve.
Yeah, I think what's so interesting from a regulator standpoint is really how innovative they are being. And they have been innovative for many years, but it feels to me that, there's a lot of acceleration happening now with that kind of innovation. And, we have worked with, both at the federal level and at the state level. They're waking up every day and saying, how do we improve the health outcomes of our constituents? We had worked with a state, Louisiana, to really look at their outcomes. And one of the barriers that they saw was, hey, a lot of our, if you look at a map of Louisiana, a lot of that are sort of swamplands. And you can't expect patients or members to be driving through a swamp. Obviously, they have to be able to go around. And so how do you do that time and distance calculation, for those beneficiaries? Again, because it's shown time and time again, when you have a person who is able to access the care that they need, they're going to get better outcomes. And so really, it was a great example of how we were able to deliver innovation, for our states and for our regulators. And Sean, it looks like your dog maybe wants to join the conversation too, which is great.
I'm so sorry. She's a bear. It felt like she's a huge bird. Yeah, she's a birdadoodle, and anytime she hears me have a conversation, she wants to be a part of it. So, and her name is Taylor Swift. That's
awesome. That's great.
Awesome. Well, welcome Taylor Swift to the podcast.
Yes. We didn't think we'd have such a star on, in addition to you, Shanna.
Yeah, no, she always wants to be the star. So
there you go. Shanna, I didn't know if you wanted to remark it all around regulations, because obviously that's a complexity that adds to, what it is that everyone's trying to accomplish, which again is that access to care, that that patient journey.
Hold on one second. Yeah. I apologize.
No worries.
No, it definitely is a part that adds to that piece. And, there's such complexity around all of, when we think about how much we need healthcare to transform. It's, there used to be this thought, kind of going back to even what we said at the very beginning, how it kind of started with this the EHR thought, but it was almost like we were thinking about it just from one little silo of how we could change healthcare. And now we realize as going into it, that's such a huge piece of it. It's complex at every level, and we have to touch every level and change every level for it actually to change.
Yeah, it cracks me up that we keep going back to electronic health records, because if you think about it, back in the day, you had files upon files back here, and you'd go find the little colored tabs, and you'd pull out the record, and it wasn't shared across the ecosystem. But as an industry, we came together and said, we have to fix this. Like, this is not okay. We have to integrate this and unite it. And it took a while for that to happen. And Shanna, you were right at the forefront of that. So, and it was revolutionary, right? At the time, to be able to have all that data at your fingertips. And I don't have my phone in front of me, but now you can just go on your phone, go to your patient portal, all that information's there. And it's like we're going through another, great data reset. Now that was similar to that, but in a much, more encompassing way, where we're saying the records were great, but now we need to integrate the whole system, right? And we need to have a view into the data on every level, whether it's, affiliations, whether it's, specialties that the providers have, just across the whole ecosystem. And I think it's one of those times it's a calling for the industry to come together and do that. And Shanna, I think you were hitting on that a little bit earlier as well, that we're all kind of going through this, one in a kind of micro level within our own organizations, trying to figure it out, but then also integrating across the industry so it has a universal impact, right?
Absolutely. And I think, Barbara, in one of our initial conversation, you had said something which I loved, which is really grounding, like where the EHR began. And it's like, and we got to see the beauty of the evolution of, oh, this can be so much more. Mm-hmm. Do you remember what I'm talking about when we were? Yes.
Yeah, absolutely. Yeah. And it's, it's sort of thinking about that signal to noise ratio is what I always think about, with the electronic data. And the EMRs were often first started really just as a billing system and then transitioned to be really more about clinical care. And I think what will be interesting too is how networks are going to evolve, how provider networks are going to evolve to really making sure that they're meeting the needs of members, meeting those needs at different stages, and really having it be cost effective, right? The last thing you want is, you've got to figure out the care that you need. You got to figure out how you're going to get it. You got to figure out, am I getting the right diagnosis? Am I being listened to? And then how am I going to pay this bill, right? So that trust aspect too, Shanna, that you talked about of, trusting that you're not going to get a Pizza Hut, but also trusting that, hey, this provider is in the network and my care will be covered when I see them versus being surprised by a bill after. Those are all the aspects that make this really complex and can really be impactful.
What's so interesting is I remember when I went through that my health journey, and it was the night before my surgery, and I made this list for my husband of things that he needed to make sure he did. When he got, a notice from my doctor, all's clear, or the surgery was successful, as I wrote down insurance and I circled it and I was call and have the conversation. And I was and I don't even want to deal with anything that has to do with that insurance piece. And so it was interesting because when I think about that, it's all of these little pieces. Insurance was just one, but I passed off to him because there was just so many things to try to connect ourselves that's where we're hopeful the future of that changes. So it's not that, divvying off the responsibility in time of crisis, or that it's, understanding before that crisis hits is even better.
Right.
But that's a piece that I'm kind of just putting the trust of my partner's hands of you go figure it out, go forth and conquer.
Yeah. And you had somebody who was your advocate, right? And,
exactly.
And of course it was still really complex and really burdensome. What happens when you don't have that? It can be so impactful, of course.
Yeah.
Thinking in that vein, and we're saying this is all happening right now. I don't know if we fast forward 5 years from now, or, 3 years from now, what does an ideal patient experience look like? What's your vision, each of you, for what a better healthcare system could be, or what could it look like? Think 5 years from now, because think how fast we're innovating. And to your point, Shanna, how quickly AI is developing. I don't know, what's your thought? What do you think of when you think 5 years from now?
I think for me, it's really that every American in the US is able to get access to care that they need, that they have that comfort and that trust that they'll be taken care of, that they're able to, see who they can access, that they have a really high level of trust really on that provider directory, that they can call up a doctor, that they can make an appointment. They can make an appointment within a reasonable amount of time that they need for the care and how urgent it is, that they're able to see that doctor. I mean, it sounds so basic, but we are not there. And that it will be a transformation that happens when everybody works together, that we all share these insights. Hey, as a payer, I called up this provider and they're no longer there. Let me share that with this network. Let me build this community in a way that improves, what we can do for everyone, and really to take out a lot of the waste in the administration that exists. And it's really going to be this interconnected, very fluid, very dynamic world. And ultimately then at the patient, at the end of the day, is able to get the care that they need.
Love that. That's snapping. I snap at everything I agree on. So I was snapping all the way through that. I mean, completely agree with you, Barbara, on everything. And I think, it's interesting to think about that healthcare is really an industry that is late to evolve. And I think that how fascinating, since it really does unite us all. Like, it comes back to that, where we started, April, on we'll all be a patient, we'll all experience it. It's late to evolve, and we need it to evolve. So it's as easy as online shopping. It's as easy as hospitality. It's as easy, in going to a luxury resort or something like that. And it's accessible in that way to everyone. And I think so when I think about the future in 5 years, I think about that's where we are with healthcare, that healthcare becomes so personal and so easy that when I go into what began as the electronic health record, the EHR, and it's something that's so simple, it knows me, it's personal, it can talk with me, it can give me real-time care. It's as easy as I order a shirt and it shows up the next day. I want to order my healthcare and it shows up right away. And so it's all of those personal touches with the experience of truly, truly bringing care to that experience of health. And I think that's a blanket over the wellness industry as well, not just when we think of traditional healthcare. But I think that's where we are in 5 years. This point of predictive, personal, and truly a spot. Yeah, and truly a spot where the care comes first before the crisis.
Yeah, I love that quote. I know you've said it a couple times, but I wrote it down at the beginning of today's discussion because I was like, I got to bring us back to that. But you've done it so often, which is great. And like I said, I think we could continue a conversation here for days. But I do want to thank you both for joining us on the podcast today. I know that this is a area of passion for both of you. You're both at the forefront of having the ability to help impact and influence where the industry heads and how we get there. I know I'll be watching and following. I'm super excited to see what both of you do in the future in both your own respective perspectives and roles, because we're at a really exciting time. And both of you have a role and impact on that. So thank you for sharing some of your insight. I think I want to be in the healthcare system that both of you are envisioning 5 years from now, for sure. Less homework, less having to be your own personal advocate or having your spouse be your advocate. Connecting all those disparate systems and data that are out there to really create a cohesive patient experience that I think is great. And to use what I wrote down at the beginning, you want to get the care before the crisis, not just get the care because there was a crisis, or as you said, crisis before the care, which was your experience. And, we hope to create something better, right, in the industry across the way. So very personal experience. Shanna, thank you for sharing that with us. And thank you for your leadership in the space. Barbara, same to you. I did want to mention the Audacious Optimism. So this optimism isn't something we just kept saying in the podcast here today. Shanna, this is your book. I've had an opportunity to read this. Very inspirational. We'll have a link on the resource page as well for people to be able to access this. Highly recommend it. This is your story. So if you heard her story at the beginning of this podcast, want to learn more about it and be inspired, I highly recommend this as a read. Again, thank you both very, very much. I look forward to watching both of you. And thank you to everyone out there for watching and listening to the Totally Adequate podcast. We know you have a ton of podcasts you can choose from, and we're glad you joined us here today. Please make sure you like us, offer suggestions. We take all your feedback to heart. It's how we improve the Totally Adequate podcast for you. And with that, I want to thank you once again, and thank you to our producers, Sophia Timmermeyer, and our video production crew at Mike Fowler Films. Thanks for listening.
Thank you for tuning in to this episode of the Totally Adequate podcast. If you enjoyed it, we'd appreciate it if you could rate us on Spotify or leave a review on your preferred podcast platform. Your feedback helps us grow and bring you even better content. We also invite you to send us any comments or topic ideas by emailing us at thetotallyadequatepodcast@questanalytics.com. The Totally Adequate podcast is produced by Fowler House Films and Quest Analytics. Thank you for listening.